The downside is just the effectiveness. When you're seeing someone who's very obese with very high BMIs and are hundreds of pounds overweight, they're not going to be as effective in those patients. The medications are expensive. Also, they're not, some patients can't get the medications, and if you're not on the medications, you're going to gain your weight back likely, and some of the patients that really need it. And some patients will limit out on symptoms, meaning that some of those medications can cause reflux and constipation and other things, nausea and such, that people might not be able to take them because of some of the side effects medications have.
Okay, and what about with the surgeries?
Surgery, the downsides of surgery, so there's a little bit more risk than just taking medications. The upsides are the effectiveness. Obviously, you're going to have the results at a much higher level and not have to take medications your whole life, and you get all that at one time. The surgeries are going to have a much higher level of improving medical issues, and obviously the results in the weight are much different.
Yeah. What is it that you see coming into your office every day are some common misperceptions about bariatric weight loss?
I don't know. I think a lot of people just think that the surgeries are probably much higher risky than they are. I think that akins back to decades ago when we did the procedures open, that we didn't see patients early in their obesity. We saw them later, so they were already more complex patients. And in that era, 20 some years ago, there were more complications, there were more issues, there were more morbidities. As the procedures have become minimally invasive, the risks our procedures are really no different than if you're having a minimally invasive gallbladder surgery or a hernia surgery or GYN type surgery. And so the risks have gone down dramatically as far as the risk of the procedures.
And what about long-term results and effectiveness? What do you see?
Yeah, long-term, it's amazing when you really think about these patients that lose all this weight, and the majority of them can keep it off. We have some patients that gain their weight back and different things that we deal with down the road. But when you're talking about medications versus surgery, the long-term effects are much better with surgery.
Here in Indiana, we have pretty high obesity rates
Mm-hmm.
and people that are overweight. What would be the word that you'd want to get out to people about how addressing this issue can be life-changing? What do you see as far as changes in your patient population?
I think we're seeing patients earlier in life. We're seeing patients when they have medical issues that are treatable, that haven't become irreversible. We see people that haven't had the orthopedic problems that they're going to get as they wait and wait. And I think we've seen people earlier in life so we can treat their obesity, and then they can just be normal the rest of their lives and be happy and healthy. And when we see people later, when they've already have significant orthopedic things or irreversible diabetes or other things, those patients don't do as well long term. So I think the push that we're seeing of younger patients is big, and we're seeing that through primary care doctors and things that are assessing people earlier in life for surgical management versus waiting till later in life.
So who is the ideal candidate that you would, you say coming in,
Mm-hmm.
this is the formula for the best outcome?
Yeah, we'd love to see people in their teens and 20s especially patients when the obesity is out of control. Someone's insulin resistant, they're not going to be able to not be morbidly obese. The younger the better, the healthier the better, and those patients do very, very well. That's not to say that people middle age and older don't do as well, but those are the ideal patients that we see that do better long term.
And what are some of the metrics as far as BMI and things like that?
The standards that are pretty much set by our societies are a body mass index of 40, which for an average sized person is about 100 pounds overweight. We also, for people who have medical issues that relates to their obesity, we go down to a body mass index of 35, which is like 75 to 80 pounds overweight. But we see people all the way up to BMIs of 100.
Wow.
Yeah.
What is the biggest mistake that patients make? The biggest pitfall?
In the post-surgical patients?
Mm-hmm. Or in maybe in delay in coming in. I don't know.
Oh, delay coming in, that's the different thing. The biggest pitfalls in patients who have surgery is just probably keeping up on the vitamin regimen, the protein regimen. That's a big deal. When we're changing anatomy, we're changing how people digest and absorb their food. It works amazingly well, but it does add another set of rules to patients as far as keeping up on different vitamins and protein requirements that other people don't have due to that anatomy. So when we see people long term, sometimes people who aren't as good with their vitamins and things, we can kind of run into some issues. And that's probably the biggest thing that we see long term is kind of this good compliance with the supplements and things like that.
Yeah. Anything else you'd like to add to this for our audience today about coming in and addressing obesity and doing it?
Yeah,
In
it's a tough thing to do. I think the hardest part is people who know they're obese, they know they're having problems, they know they need to do something. The hardest part is just going to see somebody about it. I think that it can be, is it embarrassing? Is it tough to talk to somebody about it? Is it uncomfortable? Uh, so when we see people here and our program is very warming, it's all we do. It's what we've been doing for over 20 years and 30,000 some patients. And I think when people come here, you see their shoulders come down, you see them be able to talk about it with ease and be able to talk about different things that we can do for them. Like I said, both medically, surgically, and the expertise we have, I think they feel very comfortable that the things that we offer are going to be very beneficial for them.
It must be gratifying to see such transformation in your patients.
Well, I love it. Even back when I first started in surgery, of all the different disciplines you go into, I got enamored with bariatric surgery because most disciplines, you do their appendix and you never see them again, or take their gallbladder out. This, you're really dedicated to the patient. I want them to do well because I'm going to take care of them for a long time. So I have investment in that too. So, and you see them back, and you see their hopelessness turn into happiness, and it's a real neat journey, and all of us in the program get to participate in that. It's really nice.
Dr. Evanson, thank you.
Oh, our pleasure.